I like to talk about trauma theory because my life has been one long trauma. Of course, this is in a lighter vein. Let us, for starters, look at the word trauma. Trauma can mean head trauma. Trauma can mean mental trauma. Head trauma is serious head injury, dysfunction of the brain caused by an external force. We are here not concerned about it. We are here concerned only about mental trauma. Mental trauma is an extreme experience. We usually use the word trauma to mean shock, pain, distress. But I think that would be an attempt to dilute the significance, the semantic significance of the term trauma. Trauma has two characteristics. It is an extreme experience which is beyond words. It is an extreme experience which cannot be integrated by the individual. So, what is trauma? Trauma is an extreme experience. Trauma is an extreme experience which cannot be effectively verbalized. It is so painful, so shocking, and it so much overwhelms the individual that the individual is unable to put it across in words. Secondly, it is such an extreme experience that the individual is not able to absorb it. The quantum of the extremity. The quantum of the extremity is such that it is beyond the quantum, or it is more than the quantum that can be absorbed by the individual. This is what we mean when we say trauma. Trauma theory started gaining momentum in the 1980s and the 1990s and has gone from strength to strength since then. You must remember that the 20th century was an extremely fertile period for trauma. The 20th century witnessed numerous bloody revolutions, two world wars, the Holocaust, and a catena of natural disasters. It is only natural and understandable that towards the end of the 20th century, widespread and systematic efforts should be taken to evaluate, to analyze, to evaluate, to understand trauma. It was thus that trauma theory came to be developed. Basically, there are three kinds of trauma: acute trauma, chronic trauma, and complex trauma. Acute trauma is caused by a single extreme event. I repeat, acute trauma is caused by a single extreme event. Chronic trauma is caused by repeated extreme events that form a pattern. I repeat, chronic trauma is caused by a pattern of repeated extreme events. Complex trauma is caused by multiple traumatic events, multiple extreme events. But these events do not form a pattern. I repeat, complex trauma is caused by multiple extreme events that do not form a pattern. The symptoms of trauma are usually both physical and psychological. The physical symptoms can include palpitation, exhaustion, and the psychological symptoms can include anxiety and piercing sadness. Fundamentally, as I said, trauma displays two characteristics. One, it is speechless. It is so extreme that it cannot be put in words. It cannot be expressed through speech. Two, it cannot be absorbed by the individual. It is so extreme and so high in the quantum that it cannot be absorbed by the individual. It cannot be integrated by the individual. And as a result, it severely damages the identity of the individual. It contributes to the destruction of the identity of the individual. This is perhaps the appropriate point to mention what is known as PTSD. PTSD is post traumatic stress disorder. This is a mental disorder, sometimes accompanied by physical symptoms, that a person develops after he is exposed to a traumatic event. It has to last for more than 1 month in order to qualify as PTSD. PTSD is caused by severe emotional shock or extreme pain. Needless to say, there are numerous characters in literature, in film, who undergo experiences which prevent direct linguistic expression, and which result in the fragmentation of their identities. And hence, trauma theory is a vibrant, fertile, interdisciplinary field with tremendous, with remarkable, with amazing scope and applicability.